Mr Deputy Speaker. I'm grateful to you for providing me with a few minutes to say a few words on the cap on care costs and workforce planning. With regard to the care cap, it's important to congratulate the Government for tackling a problem, for attempting to defuse a ticking time bomb that all of their predecessors have shied away from. However, there is a concern that these specific proposals are rushed and are a tag-on to a bill that was designed for a different purpose, the integration of health and social care and the setting up of integrated care systems. I accept that there is a clear correlation, but the legislation that addresses the problem of people being forced to sell their homes to pay for their care should have been considered and scrutinised separately and carefully, with the objective of putting in place a system that will last and stand the test of time and which has political consensus. This is what the Dilnot proposals and the 2014 Care Act achieved, and they should be the foundation stone on which we build this new system. My concerns are twofold, Mr Deputy Speaker. Firstly, Clause 140 is extremely unfair to those with limited assets and modest incomes. The changes may save the Government hundreds of millions of pounds, but they do so at the expense of those on low incomes and living in parts of the country where house values are lower, such as Lowestoft in my constituency. Secondly, there is the worry that working-age adults with disabilities will be unfairly penalised, and hence the other place has introduced a sub-clause to address this. I acknowledge the Government's worries of the cost implications of this additional provision, but this is an iniquity that does need to be addressed. Moving on to workforce planning. There is a staffing crisis in both the NHS, where there are 110,000 full-time equivalent vacancies, and in social care, where there are another 100,000 vacancies, a high turnover of staff, and very limited respite for unpaid and family carers. These deficiencies, Mr Deputy Speaker, cascade through the health and care system, create bed blocking in hospitals, and impede the efforts being made to reduce waiting lists. There is an urgent need for strategic planning to address this crisis. There is a concern that Framework 15 is not working, as it has inadequacies in the collection of data, it does not provide an assessment of workforce numbers, and it is not responsive to societal shifts. Since we last considered this issue last month, the other place have sought to address the Government's concerns and have, as we have heard, have made very reasonable concessions. Mr Deputy Speaker, there is a crisis that must be addressed, and at this very late stage, I would hope that the Government would accept what is a very reasonable amendment so that we can get on with this much-needed work. Thank you.
Margaret Greenwood.